County. He will be updating us on the situation of illegal drugs and how to protect yourself. When Adam was talking about the drug take-back day, that's very important to do that because one of the things that is kind of going around high schools and even middle schools is what's called a farm party. And it is not a farm like we think of a farm. It's farm like in pharmacy. So even though you think you have good grandkids, they might have friends that would influence them and may say, can you just check through your grandparents' medicine cabinet, see what they have? And they'll take these drugs and they'll pour them in a bowl and then they'll just try things. Kind of glad my daughter was an introvert and prefers to stay home watching old movies with her mother. So without any further ado, I welcome Tim LaLuzerne. Thank you.
All right, thanks everybody, and thanks for having me. Looks like we got a great turnout. Is everybody able to hear me all right, even in the back? Good? Perfect. All right, so we're going to talk a little bit today about the drug problem here in Shawano County. As you can see the picture up here on the slide, this is not Shawano County, fortunately. This is a crack house down in Chicago, and you can see the line goes all the way around the corner. I like to say we're not that bad in Shawano County yet, but if we're not careful, we may get that way someday. So, just a little bit about me. I started with the Sheriff's Department back in 2013, so I'm still a little bit of a young pup, but kind of found my niche. I've been a member of our Special Response Tactical Team and also a field training officer since 2015. And back in November of last year is when I got promoted to detective and started kind of handling our drug cases here in Shawano County. So first and foremost, when we start talking about drugs, not everybody has kind of seen or dealt with some of the stuff we're going to be talking about today. So first what we'll do is kind of go through and run down what I'm seeing is the most commonly abused drugs here in Shawano County, what they look like, how they're used, and basically some things that if you see, you should definitely basically kind of have it trigger in your mind that, hey, something's not right here because this is what I saw on that presentation a few weeks back. So marijuana, obviously there's a big political debate going on right now about marijuana and things like that. I'm not going to wade into those waters necessarily, but you still have to acknowledge that it's probably one of the most common ones that's around. So a couple different street names for it there on the bottom and kind of what it looks like kind of in the jar up there. I also do kind of like that little graphic there. It says marijuana. Hey, at least it's not crack. So. Also too, a small note, if any of you came here for free samples today, no, I don't give out free samples. Out of luck. So marijuana has kind of become a cultural thing almost now. It's not just what you're seeing as far as people smoking joints or whatever else. There's almost every product you can think of now is kind of being infused with THC or different things. We've seen THC in soda, THC in baked goods. It's really kind of all the rage right now, and especially as more states are starting to legalize, like Colorado, Michigan, and so on. We're starting to see almost widespread distribution in just about every aspect of life. So cocaine too, not one of the most popular drugs here in Shawano County, but we are starting to see it make a comeback, and I'll kind of explain why I think that is here in a couple slides. Typically when we see it, it's mostly in the white powder form, and a couple of names for it there on the bottom. And also the crack cocaine variety, it's usually a chunkier substance, more rock-like, as pictured there on the left. So obviously most common, you're going to have snorting and smoking as your means of ingestion. I've yet to meet the guy who can throw that much on a bicycle to town, but chances are you'll end up in the hospital that way, but you never know. And just some of the common packaging things. One of the things I always like to point out too is different household items that most innocent people look at and say, oh, that's not a big deal, but to me as a detective, stands out like a sore thumb. And for me, the number one is you'll see those little plastic twisties on the bottom there. If you ever come across a bunch of Ziploc bags that have the corners torn off of it, I don't know about you, but I don't know how much useful a Ziploc bag is if it's missing the corners. So that tells me that there's a little bit something suspicious going on there if I'm finding a bunch of baggie corners torn off, because that's probably one of the most common packaging forms here. All right, now we get into, as it was kind of touched on earlier, prescription drugs are really kind of one of the big issues we need to address here. And that's not to say that people that are on prescription drugs are bad people or anything. Obviously, they improve a lot of our qualities of life significantly. But we also have to kind of understand some of the risks that go along with that. We hear in the news just about every day about the opioid crisis. But also, too, it's not just the opioids that are problems. We're seeing issues with depressants, sleep medications, and especially stimulants really becoming almost kind of, you always hear the phrase gateway drug. Well, most of the people that I interview with that either have meth addictions or things like that, they started on prescription stimulants. People that have heroin addictions, they started on prescription opioids. So we really need to kind of be aware of how dangerous these things are. Like I said, it's not bad. Each of us have prescriptions for all these things. But if we're not careful with them, we can really kind of put somebody in harm's way if we don't manage them properly. So when they're used basically in not legal formats, they're typically crushed and snorted or sometimes heated up on a spoon, melted, and then injected. Still doesn't quite make sense to me why you'd want to inject molten hot pills into your veins, but apparently it works. And also obviously the most common method of eating. So this slide always gets me. Pain pills, just not for Brett Favre. What really slays me about this is when I give this presentation in the high schools, I have to explain to people who Brett Favre is.
Yeah.
So at least this audience will understand. As was mentioned earlier, these are probably the #1 most abused drugs by our school-age kids, whether it's high school, middle school, or what have you. All these different types of medications are readily available in just about everybody's medicine cabinets. And so kids can get their hands on them really easy, and then they turn around and sell them at the schools for cash or for use at parties like was mentioned. The common ones, obviously oxycodone, Percocet, and things like that. So, which kind of leads into the heroin issue. Heroin is not as widespread here in Shawano as in some parts of the state, but it's definitely around. Fortunately, we've really taken some heavy efforts in order to try and eradicate that from our community, and it's kind of showed up as we go from there. You may not know where basically heroin comes from. On the right side there is basically the opium poppy plant. It's typically cultivated in other countries and then refined and broken down into a powder that looks like it on the left. So,
Those oriental poppies, are those the ones we have in our gardens?
the stuff that you have in your garden, you're good to go on. Depending on what kind of garden you have, we'll talk later. But one of the reasons too we kind of saw a spike in the heroin use is one of the primary countries that grows opium as a cash crop is Afghanistan. So obviously we had a lot of troops coming back from that region of the country, going through a variety of mental health concerns and things like that. And we actually saw it was so readily available over there that when soldiers started to come back, it started to come back with them too. And that's why we kind of saw a recent uptake in our the heroin availability, I guess. So a couple common methods of ingestion there. You have your smoking and injecting. For a while there, people were really shying away from the injecting. Obviously the needles, the concerns with needle-borne illnesses, HIV, AIDS, Hep C, things like that. But sad to say, we're actually kind of seeing a resurgence of that. Whether it's at parks or different places, we're starting to see a lot of needles being improperly disposed of and stuff like that. Obviously, if you're out and about and you see something like that, give us a call right away. I highly recommend that you don't touch any of these things. Like I said, you never really know what kind of substance was associated with it here, and you don't want to expose yourself to anything that may be potentially harmful. So, some evidence of abuse, like I said, if you see needles and syringes laying around. Another one that always kind of catches my eye too is if you're seeing a spoon with like a bunch of burn marks on the bottom and like almost like a residue on top. I've never cooked anything on a spoon with a lighter, at least as far as food goes, so that's usually a good clue as to drug use. And then aluminum foil with burn marks, cut straws that are used for snorting, missing shoelaces. A lot of you might be wondering what the heck that's about. Makeshift tourniquets. Tie a shoelace around your arm and inject. So, just like I said, everyday items that you may not look twice at, but after this presentation you'll kind of have that awareness that says, hey, wait a minute, I have a needle, I have a shoelace, I have a spoon. Hey, there we go. So, all right, on to the next one. And just some common forms of heroin packaging. Like with all drugs, you never really know what you're going to see it in, but we do see these as kind of the most common. Obviously, again, the baggies, different little balloons, and also even taking straws and heat sealing the ends, and then filling, like, heat seal one end, fill it with powder, and then heat seal the other end. Can be passed hand to hand, almost undetectable. So just some of the stuff that we've seen come into the office recently. And then fentanyl is kind of the big one that has us all a little bit scared. I would say the majority of times that we have heroin come into our evidence lab, it has some trace of fentanyl in it. We've had a number of cases just this year where drugs that were seized off the road, whether it was on traffic stops or anything else, that were coming back with fentanyl. Now again, fentanyl also has therapeutic uses. Fentanyl patches and stuff like that are great solutions for pain relief. That's not so much what we're seeing when you see in the news about the fentanyl problem. It's not necessarily those types of things. What we're actually seeing is another overseas problem. Countries are almost importing it in as a cash crop. And we call it gray death because it's usually this gray powder looking substance. And it's so cheap and it's so potent that it's just basically spreading like wildfire across the country. We've had cases even in like New York Harbor and things like that where whole container ships, where we're talking tons and tons of that stuff. It's just really scary. Next slide. So like I said, the patches and things like that, not typically what we're concerned with, although if you do have these things, I highly recommend if you destroy them properly. One of the things we'll see is a lot of people that have really bad addiction problems, if they know somebody that is a fentanyl patch user, they'll actually dig through their garbage and try and find spare fentanyl patches and they'll chew on them to try and get any kind of residual effect. I've heard of different care facilities that basically their policy for disposal is to cut them up and mix them with coffee grounds. I don't know if that helps or not. My line of thinking is if somebody has an addiction problem that bad, they're probably going to overcome whatever means they have to get at it. So it's best to just dispose of them as best you can. Also, we see it in kind of like pill form. People will take that powder and press it into pill form and sell it almost as anything else. Which is also why you should always make sure your prescriptions are coming from a reputable pharmacy. We've seen pure fentanyl pills that are marketed as oxycodone or other drugs that people take quite regularly, which is again scary when you consider the fact that at high schools these things are basically being passed around here and there. They may think they're buying an oxycodone pill, but they might actually be buying a fentanyl pill. And I can tell you, if you don't have a resistance to opioid medications, one of those will quite easily overdose you and kill you very rapidly. Because actually here's an amount of fentanyl that would be a lethal dose in most of us. So, as reference to a penny, just a couple grains we're talking, which makes it really scary for me when our officers are coming across this stuff on traffic stops, and it's powder and it's in bags. Could you imagine just that simple little bit getting on your shirt? You go to brush it off, it can get absorbed through your skin and different things like that. So, this is kind of one of the reasons our office is basically, now all our deputies carry Narcan with them, just in case our officers are exposed to it. But also too, because these strong opioids are so prevalent in our community, it's also been used several times both in our jail and in the field too to basically assist people who are displaying symptoms of an opioid overdose. So just some packaging on the fentanyl as it goes through there. Again, we have pills, powder, and just about everything you can think of. So if we ever would have a fentanyl incident, fortunately, I can think of only 1 or 2 times where we really had to go to this level where we had a large amount of fentanyl. It requires a full-on hazmat cleanup. Obviously, just given the dangers to everybody involved, we want to take no chances. So it's really quite problematic. You can see you have to go with the full hazmat suits, hosed off, everything else. Everything gets bagged up, thrown away afterwards. You can pretty much figure that if I come across a fentanyl scene, my weekend is going to be pretty much shot because I'll be wearing a suit all weekend. Trying to get this stuff cleaned up. So it's really dangerous and everybody kind of needs to be aware of how serious it is. So if you come across it, don't go anywhere near it, don't touch it. Just if you suspect anything like that, give us a call. We can come out and take a look at it because we don't want to have to decontaminate an entire facility. So kind of switching gears here, this is the drug that I feel like is sweeping across Shawano County the most rapidly. In fact, we're on a course and trajectory right now where this may be even more common than marijuana right now. Methamphetamine is taking over Shawano streets like crazy. It's just everywhere. When I first started here, if you would have told me that we would be making multiple pound level seizures of methamphetamine, I'd have told you you're nuts. Yet that's pretty much primarily what I deal with on a daily basis. Couple different names to it. If you ever happen to see your kids or grandkids' phones and they're talking about ordering up an ounce of Tina or something like that, they're probably talking about meth. So that's kind of what it looks like. Typically you're going to see it more in the crystal form there on the bottom left. We don't see a lot of the powder as much anymore. One of the interesting trends too is also when I first started here, we would see meth primarily made what we would call backyard cook meth. You know, somebody mixing a bunch of chemicals together, shaking it all up, and making it that way. What we're actually seeing now is following the normal drug trade routes from our southern border and other places, methamphetamine is coming across in just massive volumes and impurity levels that we've never seen before. One of our recent cases we had, the meth was actually like almost 80% pure. And so it's highly potent stuff now, and it's just everywhere.
So what do? They, with the glass tank one, do they crush it up and use it, or what do they do?
Yep, we'll slide to the next slide. That'll kind of explain it a little bit better. So basically what you're doing is, when it comes across, we've seen it transported into Wisconsin in a couple different forms, either in bulk crystal quantity, that's why they call it crystal meth, but also we've seen it brought up in liquid form, you know, disguised in antifreeze containers or stuff like that. They'll basically crystallize it, break up the crystals, and then sell it off. And then when it gets to the end user, you'll typically, just like with the other drugs, either put a couple crystals in the pipe, smoke it out of the pipe, or heat it on a spoon, melt it, and inject it. Or also too, we have some people snort it. I've also heard of people just eating it. I gotta imagine that it tastes awful, however, knowing what it's made with. But yeah, so it comes up in these crystals. You know, we see it, like I said, you picture your gallon freezer Ziploc bags. You know, you can see a whole thing of that just full of crystals, and then it'll get distributed out in small quantities, down to almost 1/10 of a gram. Depending on how bad someone's addiction is, they'll typically be using either 1/10 of a gram or 1/2 a gram at a time. Some people that have more serious problems go up from there. It's usually sold in what we call 8-ball quantities, which is about 3.5 grams, give or take. But yeah, it's really becoming a problem. A lot of people are addicted to it, and I'll kind of get into why that is here in a little bit. Next slide. So that's kind of all the different drugs that are out there, kind of what we're seeing. So we all know it's a problem, but why is it a problem? Why hasn't it gone away? I mean, drugs have been around forever. Why aren't we making some progress on it? And what can we do to basically deal with the situation? I usually try and break it down into 4 problems, or basically 4 kind of areas. You know, we all know it's a problem, but what specifically problems are there? And I look at the public health aspect of it, the public safety aspect of it, the economic portion of the drug problem, and also the lack of awareness and understanding. So, go to the next step. So as far as the public health crisis goes, maybe a little bit of a shocking fact there, but about 11 out of every 1,000 people in Shawano County are dealing with some sort of substance addiction. So that's a crazy high number. Back in 2017, there was 1,100 overdose deaths in Wisconsin due to drugs. And also, like I said, with the meth being such a problem, we're spending about $424 million on the health consequences of methamphetamine use. That's both people missing work, lost productivity, and also the medical costs in the healthcare system and the burden on our hospitals. Now, this map here basically categorizes the rate of substance use for every county in Wisconsin. The darker it's shaded, the more problem that area has. And you'll notice the darkest shaded area is our neighboring county right to the north, and the second darkest shading is Shawano County. So obviously we have, in this region, we really have an issue with substance abuse. Just another little fact here, 960 people died from opioid overdoses specifically, which was more than the number that were killed in car crashes, and that was back in 2017. We make all kinds of efforts every day to make our roads safer and things like that, which is helping, but also too, we need to realize that this opioid problem is killing just as many people. So, without naming names, I want you all to picture who you think is probably the biggest drug dealer in Shawano County. Just kind of what that person would look like, what kind of car they would drive. All right, keep that picture in your head. Go ahead and click it. Did anybody think Walgreens? Probably not. And that's another one of these kind of public awareness things that I want to put out there is the biggest distributors of controlled substances in our community are actually the legitimate businesses, the legitimate pharmacies. They are putting a lot of these different things out there. So you can go to the next one. What is interesting too is as the opioid crisis kind of got going and stuff like that, we really started to take a look at, you know, what kinds of prescriptions are being prescribed, how often are they being prescribed, and what we actually start to notice, I know it's kind of hard to see the numbers here, but basically this is kind of a graph of the number of prescriptions that were dispensed for each different medication there. Now, we have about 40,000 people here in Shawano County. It's a little bit concerning to me that there were 114,000 prescriptions for hydrocodone dispensed. It was also a little bit, we have amphetamines, 74,000 doses of amphetamines prescribed just in Shawano County. And yet we wonder why methamphetamine, which mirrors a lot of the same effects as prescription amphetamines, are really taking off. I mean, in a community of 40,000 people, 74,000 doses are being prescribed. That's a little bit of a red flag to me. So what we need to really start doing is working with our healthcare providers, and a lot of times they don't realize this. You know, they're writing prescriptions, they think they're helping people, but they need to basically take a closer look at what we're actually doing, because it's really kind of creating some problems that may not be intended. So kind of shifting from the public health crisis, the drug problem in Shawano County also creates a public safety problem. We have a lot of violence that's a result of drug activity. Competition for drug markets. You know, different dealers are going to have conflicts over who's selling in what area and things like that. You have disputes and rip-offs among people buying and selling the drugs. Typically, if you are trying to buy drugs and you get ripped off, you're not going to call the police and report a robbery. Typically not. But it's still happening and it's still a concern. And also, individuals who are under the influence of drugs are also prone to more violent acts, which is one thing we need to be aware of. So just kind of an example of the different inmates in the state prison, and also, you know, how they basically reported that they were doing their crimes and what the purpose was. What you'll find is that the majority of different crimes, like we listed, are drug related. So violent offenses, 12% had to do with drug activity. You know, 5% of it was homicides, 27% were robberies. Obviously burglaries. These drugs, as we'll get into in a little bit on the economic side, are not cheap. And a lot of times, if you're using drugs all the time, you're probably not the most attentive employee or going to work and having a job. So, well, how are you going to pay for your fix? Well, they're probably going to steal stuff. So, and that's represented in the statistics here. So, also, like I said, people that are under the influence are more than likely to commit crimes. Not only is possession itself a crime, but also we find out too that people are generally more violent when they're under the influence of things. In fact, any violent crime, you're probably almost 20% more likely to commit a violent crime if you're under the influence of some sort of drug. So that's a pretty shocking number there. And then also too, the one I think should concern most of us. Most of us are not using illegal drugs. Most of us are not selling illegal drugs. So we don't necessarily have to worry about getting into that culture